This is a case study of a cirrhotic liver, and it shows you multiple hypoechoic, almost sub-centimeter. In this view, you are seeing sub-centimeter focal lesions, hypoechoic. This one. Let me make it more clear. This is the left lobe of the liver in transverse section, and all the tiny cystic areas, not cystic, rather hypoechoic areas in view. If this is a cyst, then there should have been a posterior shadow or an acoustic shadow. But you see all of these are metastatic lesions, sub-centimeter interspread throughout the liver parenchyma of the left lobe of the liver in transverse section with irregular outer surface, post section. This is the ligamentum venosum, and this is the caudate lobe. Even caudate lobe is not spared of the focal lesions, metastatic lesions, focal lesions. This is 1, 2, 3, 4, 5, 6, 7, 8. So there are multiple focal lesions. This is the IVC coursing posterior to the caudate lobe of the liver. This is the caudate lobe, which is bounded anteriorly by the ligamentum venosum. This is the ascending portion of the left portal vein. Now, if you see that the caudate lobe is not only that it is 1, 2, 3, 4, 5, 6, 7, and go on counting like this, you are seeing multiple hypoechoic sub-centimeter focal lesions, both in the left lobe of the liver. Now this is the left lobe of the liver in longitudinal section. Again you see multiple hypoechoic sub-centimeter areas throughout the parenchyma of the liver of the left lobe. This is the ligamentum venosum, this curve-shaped linear structure, this curve-shaped right echogenic area, and this is the IVC. In longitudinal section, this is the portal vein, and you see that the echogenicity and texture of the caudate lobe is almost equal to that of the liver anterior to it. In segment 2, segment 3, segment 4, all the segments show the same echogenicity and texture and as that of the caudate lobe, whereas normally the caudate lobe we do see is spared in cirrhotic process because the caudate lobe or segment 1 has its own separate blood supply. Here the caudate lobe measures 9.6 millimeters by 4.7 centimeters, and thus the caudate lobe of the liver is definitely showing hyperplasia. So this is now let's see that what is the status of the portal vein. The portal vein, this is the portal vein, normal in diameter and is patent as well, measures 11.7, up to 6 is normal, up to 13 is normal. Here you see this is the right lobe of the liver, again studied with numerous uncountable sub-centimeter hypoechoic lesions, and this is the kidney with the right lobe of the liver. This is the kidney, and anterior to it is the liver. This is an echogenic area as well within this cirrhotic liver with multiple echogenic as well as hypoechoic sub-centimeter areas. This is the sub-centimeter echogenic area, 2, 3, 4, 5, 6, 7. In this view, we can see now this is the transverse section of the kidney as well as the right lobe of the liver. Now we are seeing the right lobe of the liver from subpostural view, and if you see there is a solid echogenic area. This is a focal lean. You see from here to here and from here to here. The characteristic of this focal lean is that this is actually the focal lean measuring 6 by 5 centimeter, and this echogenic area with internal cystic area as well is HCC or hepatocellular carcinoma, and it's medial as well as lateral as well as medial posterior surface is seen containing fluid. So there is fluid alongside the inferior margins of this inferior, lateral and medial margin of this solid focal mass lesion in the cirrhotic liver, right side. So, and this is the diaphragm, right hemidiaphragm. We don't see any fluid anterior to it. These are the hypoechoic lesions. These are echogenic particles, multiple, numerous, that are obviously, that is quite obviously seen in this segment. Tiny, you cannot count these tiny echogenic particles within this cirrhotic liver. So, this fluid is suggestive of internal degeneration because its fluid is not clear, it contains internal echogenicity. So this is a complex sort of mass, this one extending from segment 6 to segment 7, cystic and solid focal mass lesion. You see one more. Here is the other one. You see there, this is another focal lesion which is hypoechoic in the right lobe of the liver. This is the focal lesion, this area. This is the right kidney in transverse section. This is the kidney in transverse section. There is no evidence of intrahepatic bile duct ectasia. There is, this is the gallbladder. This is the gallbladder, which is normal. This is the middle hepatic vein. And note the tortuosity of the margin of this surface. Note the echogenicities, bright, shiny. So many of these are seen in this view. These are nodules, macronodular cirrhosis with hepatoma and with numerous mets within it, as well as hyperplasia of the caudate lobe of the liver, also involved in the metastatic process as well as the cirrhotic process. So in this case we do see all types of lesions, almost all types of lesions we have gone through. Echogenic, as well as numerous hypoechoic papillions. See them? And this is the case of the day. Thank you very much.